Hi, Sydney. So I know you're going home today with little Junior here. He's so cute with his open mouth. So I'm going to go over some things with you so you know how to kind of care for yourself and for him. What's his name?
Maurice.
Maurice. Beautiful. Okay. So I'm going to go over some things so you know how to care for yourself and for Maurice once you go home. And then I'll give you this booklet to take home with you, and it'll just go a little bit more in depth with some of the things we're going to talk about. Okay? So first we'll start with you. So for one of the first things I know you're going to feel a little bit of anxiety about is breastfeeding. So to help get your breasts ready for breastfeeding, you're going to want to stimulate them every hour and a half to 2 hours to promote the milk production. Don't wear any bras with like the underwire in it because it'll mess up with the milk production. And then whenever you feel like they're like way too full to engorge, take a warm shower before breastfeeding to promote the milk flow. And then you can apply breast milk to your nipples and allow it to air dry to relieve some of the soreness there. As far as activity, when you leave the hospital, so you're not going to lift anything heavier than Maurice, and you're going to limit the amount of stairs that you take. So luckily I know you live in an apartment, you have an elevator. Just take the elevator, don't take the stairs, don't be extra. No matter how much you want to lose that baby weight. Avoid pools and hot tubs until you stop bleeding, which is going to be in about 4 to 6 weeks. Don't use any tampons or menstrual cups. So if you get your period, just use pads. You're not going to get your period, so that's a weird thing to say. But while you're bleeding, just use pads every day. And then you're going to wait at least 6 weeks and then get examined by your doctor before engaging in any sexual intercourse. So tell Johnny no, maybe a little bit. So I know you just had a C-section. So the healing for the C-section can take up to 6 months. So you may feel a little discomfort during that time. You're going to want to walk as much as possible to prevent any blood clots from forming. You've done pretty well with the pain so far, so just get up, keep moving around. And moving around will also help kind of relieve some of that constipation since the epidural kind of slows things down and decrease some of those gas pains. With that incision being on your belly, the easiest way to hold Maurice is going to be using like the football or laid back position to avoid pressure on the incision. If you're going to lift anything, use your legs. Anytime you need to cough, sneeze, anything like that, splint the incision with the pillow to kind of protect it so it doesn't split open. Rolling out of bed, do kind of like a log roll, same thing with splinting the incision so you don't mess up the incision there. And then keep it dry and clean. Use warm soapy water to wash it daily. Keep an eye out for any signs of infection, redness, drainage, swelling, foul odor, that kind of thing. If any of that comes up, that's when you would want to call your doctor. Which brings me to my next section, the signs and symptoms of infection. Like I said, that redness, drainage, swelling on the incision, any separation around the edges of it, because that may mean that when you've coughed or sneezed, something like that, it's come open a little bit. Any increased swelling there, if you all of a sudden get a temperature over 100.4, any sudden pain that gets stronger in that incision area. And then if you have any redness, tenderness in your legs or arms, keep an eye out for that because it could mean, it could be a sign of blood clot. Also with chest pain, shortness of breath, same thing. So if any of that comes up, that's when you want to call the doctor. You're going to follow up with your primary doctor in 2 weeks. They're going to take a look at the incision, just see how you're doing, all that kind of stuff. Any other signs or symptoms that you would need to call your doctor for? If you have any heavy bleeding that doesn't, heavy vaginal bleeding that doesn't slow down, if you soak through 1 or more pads in an hour, or if you pass any blood clots larger than like the size of an egg. your drop in blood pressure or any kind of signs of shock, blurry vision, chills, clammy skin, fast heart rate, confusion, dizziness, faintness, nausea, vomiting, if you have any sudden swelling of your face or your limbs, persistent headache, abdominal pain, more so than just kind of some slight pain. If you're having any decrease in urination, sudden shortness of breath, that kind of thing. All of those signs, if any of those come up, that's when you want to immediately come in or call your doctor so we can check you out, make sure everything's doing okay. As far as Maurice goes, breastfeeding. I know that's your preference, so should be feeding him about 8 to 12 times per day, and that includes throughout the night. Don't go more than 4-5 hours between feeds. So today, he's been eating about 22 to 27 milliliters per feeding. By the end of this week, it'll be more so like 45 to 60 milliliters per feeding. And then by the end of the month, 80 to 150 milliliters. And whenever he'll tell you when he's full, he'll stop eating. So don't, force him to keep eating, because he'll start vomiting, that kind of thing. As far as his urine and stool, you should have 1 wet diaper for each day of life this first week, and then it should be around 10 wet diapers every day after that. And then he should have 4 or more stools every day by about 2 days from now, so about day 5, you should be having 4 or more. If you notice any decrease in wet diapers, Maurice, any decrease in wet diapers or stools, notice that there's not enough wet diapers throughout the day, call your doctor so we can get him checked out, or his doctor. For his umbilical cord, right now we've still got the clamp on the cord, so you want to make sure when you are changing his diaper that you fold it down towards the inside so that you can keep the top of the diaper away from that cord while it's healing. Dress him in loose clothing so air can get to it still. The cord itself will fall off in a few weeks by itself, and there may be a small amount of blood. Keep an eye out for any signs of infection, same kinds, any redness, drainage, swelling, if there's any kind of foul smell. That's when you would need to call the doctor, get him checked out. As far as bathing him, you should bathe, I think so. You should bathe him about 2 to 3 times a week. This is all that's really necessary. So you're gonna when you bathe him, you're gonna grab a towel, washcloths, mild baby soap, and a diaper. Wrap him up in a towel and wash him good from top to bottom. Keep him wrapped up, and then with each section that you're washing, you're gonna fold the towel down just enough to wash that section. And then kind of in between each section, you're gonna dry him off. And that's because, he's not able to regulate his temperature very well, not the way that you and I can. He's got thinner skin than we do. He can't shiver, so he has a harder time keeping that heat in. So you want to make sure you keep him dry. Other ways to kind of minimize heat loss, skin to skin contact. Put him skin to skin as much as you're able to. Keep him dry, cover him in a blanket, and if you notice that he's cold, breastfeed. Breastfeeding helps. To take his temperature, you're going to take it with a thermometer in the middle of his armpit, and then hold his arm against his body until the thermometer beeps. You can also take it rectally, but in his armpit should be fine. You want to make sure this temperature stays above 97.7 degrees Fahrenheit, and it can go up to 99.5, but he shouldn't have any issues with any fevers. As far as sleeping for him, he should be sleeping in the same room with you for the first 6 months, but don't let him sleep in the bed with you. because that could cause SIDS, sudden infant death syndrome. Make sure he sleeps on his back, same thing. If he sleeps on his stomach or on his side, he can turn onto his stomach, and then that can cause SIDS. There shouldn't be anything else in the crib with him. Don't put any blankets in there, no toys, nothing like that, nothing within his reach. If you're worried about him getting cold, then you're gonna wear one of those sleeper suits with the zipper. Sleep sack, there you go. But make sure not to have any blankets in the crib. Let's see, his circumcision, make sure you're taking a look at it every time you change his diaper, to check for bleeding, any signs of infection, that redness, drainage, swelling, foul smell, all those same signs. Make sure you keep a clean diaper, and then you're gonna apply that petroleum gauze that we went over earlier, and the A&D ointment to prevent his penis from sticking to the diaper. Okay, car seat. So he's 38 weeks, so you're good there. I know you've already got the car seat ready. It's got to be age appropriate. Just make sure that it's rear facing in the back seat of the car. That's and we can help you, get it hooked up in there. As far as infection control with him, make sure before you or anyone else touches him, wash your hands. Don't let any sick people around him. Just kind of limit anyone that you allow to touch him, because he's not able to fight off infection as well as you and I. And then clean any toys that he's touching, high chairs, anything that he's going to come in contact with a lot. You may notice, especially because you have the C-section, he may have increased mucus production during the first few days here. If you notice any secretions in his mouth or his nose, you can position him on his back, and then use that bulb syringe that you saw me use on him a few times to suction his airways that way. Okay, so signs and symptoms of infection in Maurice. So he's going to display it a little bit differently than you and I. He's not going to get a fever like we would. So signs of infection in infants aren't super specific. They may look like persistent crying, irritability, lethargy. If he's refusing to breastfeed, if his temperature's too low, he may get that jaundice, the yellow skin, pale skin, and then he may show it the most with breathing issues. His breathing speeds up way too much. His nasal starts flaring. He starts grunting, things like that. Now, if his temperature gets any higher than 99.5, if he's got any green or bloody vomit, if he's having any of those breathing issues, any frequent coughing, lethargy, if he's hard to wake up, constant crying, projectile vomiting, if his skin is pale, blue or gray, those are some symptoms that would require immediate medical attention. So you're going to bring him in to the hospital as soon as possible, just so we can check him out, make sure everything's okay. But for follow-up appointments, he's got one scheduled in 2 days from now at his pediatrician. Then after that, he'll have one in another week or two. Then 4 weeks from now, 2 months, 4 months, 6 months, ongoing. So that way the doctor can assess him at each of the visits and then go over the vaccine schedules with you. Let's see. I think that might be it. Like I said, I'm going to give you this booklet. Kind of goes in depth about everything that we talked about. So you can always look through here. You've got my number, so you can call me if you have any additional questions after you leave. Are there any questions you have for me right now?
No, not right now.
Perfect. Well, I know you're going to do great, and Maurice is going to do great. I'm so happy for you. Congratulations. And I know you're glad to go home, so here's this for you.
Thank you.
All right, and I'll go get your paperwork ready for you. Just let me know if you have any questions. I'll be back in just a minute for you.
All right, thank you.